Welcome everybody, this is Edwin, co-founder of Fleming MedLab. We are a medical technology company designing wearable robots to help stroke survivors walk again and recover their brains. We've discovered there is a problem in the industry that a lot of resources went into surgical tools, drug development, etc., but very few went into rehabilitation and post-surgery recovery. Among the time we work with different clinicians, therapists, and stroke patients, we learned that stroke is not as lethal as we thought, but it is so debilitating that it is the leading cause of long-term disability. That's why we set out to help stroke patients to regain their mobility and get back to their life. With stroke being a brain injury, either a rupture or a blockage of blood vessels, over 80% of the patients would suffer from mobility issues. They will have the motor functions coordinations problem, but a lot more of them will suffer from other things like swallowing problem or cognitive issues. But usually there are three common symptoms they all experience. First, being spasticity, meaning very stiff muscles. Second, spasms. Third, foot drop. A lot of the patients would suffer from the foot drop issues. Their ankles are forever tilted downwards, meaning when they walk or get on stairs, they will drag their feet and sometimes they will fall again. And statistics show actually there are 8 times higher chances for stroke patients to fall comparing to a regular elderly. And this will also trigger their subsequent stroke events. And alternatively, when we are observing specifically for walking tools, the equipments they use, they are either very old or very bulky. You can think of like treadmills or the walking robots that are attached to the wall based on AC supply, meaning the therapist cannot take the robots to out calls or carry to different wards in the same hospital. After meeting with different therapists, stroke patients, and their family members, we have now designed the latest generation of Fleming Ankle. This product is specifically designed to address two things: active learning and functional movements. I'll explain them one by one. First, for active learning, we defined it as in the brain is sending signals to proactively control the body to move. If the brain is not sending any impulses, any signals, the machines shall not move. That is one of the flaws that we've seen in other machines in the market right now. You can see from the form factor, not only is it very sleek that it can address the foot drop issue, but also it helps to improve the patient's inversion and eversion issue. Alongside with it, we have electrodes for functional electrical stimulation that helps to improve the overall muscle tone, but also improves the neural feedback. Apart from being an active training model, we also focus a lot on functional movements, meaning whether the patients can actually wear the robot and perform the regular movements. You can see the entire setup, not just the robot, but also the control set, is very sleek and compact. The patients can wear the entire setup and do all sorts of regular activities like walking on grounds, getting on slopes, getting on stairs, etc. These are the activities that other machines cannot perform. Not just for patients, but for therapists, they can take this very compact setup to the out calls or transfer to different floors of the same facilities. Thank you very much for your time. Our company is now conducting our first phase of clinical trial, and we are preparing a soft launch to the market in Q1 2023. If you have any questions, no matter you are a therapist, clinicians, or if you're a family member of patients, feel free to reach out to me.